You're watching CoastLife, and yes, Rachel Parker is on the CoastLife couch with me again hosting today. Paige still taking a couple of vacation days, so Rachel's doing an excellent job filling in.
Trying my best.
Well, we love having you here, and we love introducing you to so many important community members on coastal Delmarva, and I know that October is done. We just wrapped up Breast Cancer Awareness Month, but that doesn't mean we have to stop talking about breast cancer awareness and what BB can do for you if you do receive that breast cancer diagnosis. So joining us on the couch today is Dr. Karen Barbosa. Welcome.
Hi.
Now, you are an oncoplastic surgeon.
Correct. Nicely done. Excellent. Bravo.
Wow.
So,
So
yes.
if you're like me, and probably most of our viewers, what does that mean?
So oncoplastic surgery has been done in Europe for many, many years, and it was recently brought to the U.S. probably about 10 or 15 years ago. And it basically is the fusion of plastic surgery and cancer surgery. So it's about taking out the cancer in an oncologically safe manner, meaning getting a negative margin, making sure the patient's cancer-free, but also optimizing their cosmetic result.
Yes.
So that it's not just about, well, I saved your life, good luck, however it looks, we'll fix it later. It's about planning your surgery at the day of consenting, that we are gonna do the best we can to not only get rid of the cancer with a negative margin, but we're gonna try to keep the cosmetic appearance as good or sometimes even better, because we can do it through a breast reduction or a breast lift. There are a lot of things that we can do now that are available to women, so we want people to know about it.
Yeah, and I mean, I think that's also something from a female doctors and surgeons perspective that I think so many people forget that, you know, even if the cancer is gone, it sometimes takes womanhood with it. And I think being able to reconstruct that look sort of gives at least a part of your womanhood back.
Yeah,
So-
some confidence.
It's absolutely so important, because what patients often say to me is, just get it out, I just want it out. And I say, well, where are you going to be thinking in 5 years from now, in 10 years from now? You're going to look down and go, oh, I wish they'd done a little bit more effort in making me look normal, or now I've got to go back and do something else. So I think that it's really important for women to understand that. I always say, you never make a decision in a foxhole. When you feel like you're getting bombarded and you're in the crosshairs, you've got to make a decision, but you don't have to make a rash decision. And my job is to kind of slow patients down, talk to them about treatment options, what's available for them. I always present a palette. These are treatment options. This one's available to you. This one's not as oncologically safe. So we want to work within different parameters. What's cancer safe? What's cosmetically safe? And then work with what's their body type, right? So certain people are going to be candidates for certain things that other patients won't. So not one shoe fits all kind of perspective.
That's amazing. I love that perspective, and I love how you're really thinking about the whole person and not just the disease.
We have to say thank you to Patrick Borgen at Sloan Kettering, because when I was rotating through Sloan Kettering as a resident for many years, and he finally said to me, what are you going to be when you grow up? And I said, I'm going to be a plastic surgeon. And he said, no, you're not. You talk to patients, you care about people. You would be a great breast surgeon because you want the cosmetic outcome to look good, but you also want patients to do well. And he said that hybrid. So I always used to see him at conferences to say, curses Pat Borgen, I'm still single, but I'm doing what I love. You know, it's a crosshairs of life, but it turned out to be the best decision of my life, because I just kept augmenting my ability to optimize the cosmetics. And when I first started in 2007, a long time ago, it was really not much options. It was just a reduction pattern. And then as I started taking courses, I traveled to Brazil, I traveled to Argentina, I traveled in plastic surgery circles, and have gone to some conferences. And it's really important because it just keeps growing, what we know and what our treatment options are. And I have to say a little bit, nobody knows we're talking, right? Just between us
Just
girls.
us girls. Oh, yeah.
So in the U.S., we're a little behind. Just saying it's all, We really have so much more out there, and that's why I've traveled overseas, is because oncoplasty in other countries is brought up. If you're a breast surgeon, you should be doing A to Z. In the U.S., you do a cancer, and then you have a plastic surgeon step in. Well, sometimes waiting for a plastic surgeon, depending on where you practice, can be a delay. So coordinating two surgeon schedules can say, well, we have to now wait an extra month or an extra 3 or 4 weeks before we can get the two schedules to align.
Yes.
So Oncoplasty, getting one surgeon to take patients from start to finish is just a great option. And I have to say a shout out again to my buddy Tom Davenport, who's a plastic surgeon in New York, who I adore, and we used to work together in the OR, Mutt and Jeff. Dr. Nelson Goldberg at University of Maryland, I adore him. We used to work together. He used to call me Pipsqueak, and I would say, that's Dr. Pipsqueak, show some respect. And I miss them dearly because I love my plastic surgeon colleagues. And, you know, it's a camaraderie, it's a team effort. And so it's a combination of knowing what's available.
Yeah. You're the newest breast surgeon to join the team. How do you like the BB team?
Oh my God. So it is such a pleasure to have other dedicated breast surgeons who get the lingo and who understand what I'm saying. And it's kind of this vibe of, hey, I've got a question to ask you. Let's swing this case. Let's swing that case. I mean, literally, I started my first day in the office and people were talking to me. You know, it was nice to feel like part of a team and really have this camaraderie amongst all of us. And every one of us is patient-centric. So it's, you know, whatever it takes, let's just do the best for the patient. It's not about what's easiest or what's quickest or what's financially acceptable. It's, you know, we're going to do what we need to do to make sure you get the best treatment. And it's really nice to be a part of that, you know?
Yes, and I mean, we love to have that quality of care right in our backyard.
Absolutely.
That's what I always say. When I talk to people, I say, you really want to support your local community, you know, because I can't do what I do out in private practice because I have to partner with a hospital. Some of the technology, some of the things I want to bring to the community are going to be sponsored best by a hospital. So getting everybody on the same page and having patients realize sometimes it's not easy to drive over the bridge or to drive into Jersey to get the care or drive to New York. It's a lot easier if we just build it out here and trying to bring all of this.
Well, Dr. Barbosa, there's more to talk about here when it comes to all the information and all the resources that BB has. So you're not going anywhere. We're keeping you right here on this couch. We're going to dive deeper into that and talk about how important screenings are when we get back. All right, CoastLife, before the break, we had Dr. Barbosa in studio talking about Oncoplastic surgery. There we go. That's it. Neither one of us.
Good job.
Rachel Parker with the Parker Group still on the couch as well, while Paige is enjoying a couple of vacation days. We were learning a lot of information.
Yes, a lot. I feel like I've actually gotten a little like
Our brains grew a little bit today.
I learned a little bit of medical knowledge today.
Exactly.
That was good.
Yes. Well, the medical knowledge we're still learning. Dr. Barbosa is still on the couch with us, and before the break, we were talking about Oncoplasty, what you do, how just vast this knowledge is, and how America still needs to catch up a little bit in some areas. But that's okay. That's why we've got you here, and we're also going to dive into just how important preventative screenings, mammograms, all of that is when it comes to having the best outcomes with your breast cancer diagnosis.
So, first of all, mammograms save lives. Early detection, early treatment, early intervention is really important. So if you don't know it, you can't treat it. And a lot of times you don't want to wait for it to be palpable, right? You know, if someone's small-breasted or petite, you might find something earlier. But for the most part, the majority of women are only going to be finding imaging detected things. And so getting the mammograms is really important. But also understanding your family history and understanding the risk. The majority of people don't realize this, but most patients have no family history. 80% of people who get breast cancer have no family history. So then they're like, oh, why are we talking about genetics and why are we talking about family history? Because those patients might have a genetic mutation that puts them at higher risk for not only breast cancer, but also ovarian cancer or other types of cancers. And so genetic testing is available, and doing the genomic testing of tumors is also available. Lots of exciting stuff, but also knowing where you fit into that spectrum. The reality is data is starting to show smaller cancers, early stage breast cancer, has a survival advantage with lumpectomy and radiation.
Wow.
So back in the day when I was training,
We won't say.
it was exactly soft lighting. It was important to say lumpectomy and radiation is equal to mastectomy, and the two were equivalent. But there's a lot of data coming out now that shows actually partial mastectomy and radiation is showing a survival advantage in early stage breast cancers. But I always say you keep your sensation, you keep your form. There's lots of other pros that go along with it. And a reconstruction is great. if it goes great.
Yeah.
But if it doesn't go well, then you're repeating other surgeries. So, do you really want to bang out the big gun up front on the initial go, or do you want to do a stage and see how things go, and then always potentially, if you want to upstage it later, or if you need to?
Yeah, there's obviously so much information, and we're so glad that BB has all that information and the quality care. So again, just a reminder to get those mammograms, preventative screening, and you're in some of the best hands with our friends at BB. Well, Dr. Barbosa, thank you so much for coming in and sharing all of this.
Yes,
we're,
thank
like
you.
we said,
Thanks
excited.
for having me, and I can't believe we did it so quickly. I usually lecture for like hours, and I can go on and on, but I appreciate you helping get the word out, because that's really what it is about going out into the community, getting people to know what's available. Most people aren't aware, and most providers aren't aware.
You are so unbelievably qualified in your area of expertise. I mean, so much so that we really can't fit it all into this segment with you. So if viewers are curious, we're going to link all of your qualifications and information on our website so that people know, I mean, when they're with you, they're in extremely good and qualified and caring hands, most importantly.
Thank you.
You're welcome. Well, thanks for coming in again. And as we said, we're excited to have you in Sussex County. Speaking of Sussex County, we are going to be chatting with Sussex Strong when we get back on Coast Life.